There is a natural brake inside your body that can lower your blood pressure within minutes, but nobody teaches you how to use it because it is completely free. If you clicked on this video, you are probably looking for ways to manage your blood pressure, especially using something as simple as your own breath. And yes, that is exactly what we are going to cover today. Most people have been told that controlling blood pressure means staying on medication for the rest of their lives. The doctor writes the prescription, you take the pills, the numbers shift. That is the entire conversation. But here is what that conversation leaves out. Medication addresses the pressure itself, and that matters enormously. However, it does not train your nervous system to regulate on its own. There is an entirely different piece of the equation that most people have never heard about your autonomic nervous system, and a remarkable nerve called the vagus nerve. 3 simple breathing techniques can activate this built-in pressure valve. Today, I will walk you through each one, explain the science behind it, and give you step-by-step instructions you can follow along with right now. And at the very end, I will hand you a daily practice schedule that takes less than 10 minutes, something you can start tonight, along with a reliable way to measure your results at home. Let me start with something that changes how you think about blood pressure entirely. Most people picture their arteries as rigid tubes, like plumbing in a house. But your arteries are living tissue. They stretch, they flex, they push back against the blood flowing through them. When you are younger, that flexibility comes easily. As the decades pass, the walls gradually stiffen. They lose elasticity. Your heart compensates by pushing harder, and that extra effort registers as higher numbers on the monitor. That is the mechanical side of the story, and it is well understood. But there is a second factor that deserves just as much attention, and it rarely gets mentioned at the pharmacy. Your autonomic nervous system operates behind the scenes, governing your heart rate, blood vessel tension, and stress hormones without you thinking about it. It runs on 2 settings. Think of it like driving a car. One setting is the accelerator, your sympathetic nervous system. It tightens blood vessels, speeds up the heart, and pushes pressure upward. The other setting is the brake, your parasympathetic nervous system. It widens vessels, eases the heart rate, and brings pressure down. After 60, most people are living with one foot jammed on the accelerator. Years of accumulated stress, restless nights, and that low hum of daily worry keep the sympathetic system running hot. Meanwhile, the brake weakens with age unless you deliberately engage it. That is the gap medication cannot fill. Pills adjust the numbers, but they do not teach your nervous system how to shift gears. So how does breathing tap into this system? Every time you exhale slowly, deliberately extending that breath out longer than your inhale, you send a direct electrochemical signal through the vagus nerve. This is not a metaphor. The vagus nerve runs from your brainstem all the way down through your chest and into your abdomen, and when that signal reaches your brain, the message is clear: stand down, ease up, we are safe. Your blood vessels respond by softening. The resistance drops. Your heart no longer has to push so hard. All of this happens within seconds of a slow, controlled exhale because the vagus nerve releases acetylcholine, a neurotransmitter that physically relaxes your cardiovascular system. That is chemistry, not wishful thinking. Picture your cardiovascular system as a garden hose connected to a pump. When stress has you wound tight, someone is squeezing that hose. The pump strains to push water through. When you breathe slowly and deliberately, you release that grip. Water flows freely. The pump settles down. That is not relaxation as a feeling. That is relaxation as a measurable biological event. And here is something most people never consider. When you breathe through your nose rather than your mouth, the sinuses produce a molecule called nitric oxide. Nitric oxide is one of the most powerful natural vasodilators your body makes. It travels into your lungs with each nasal inhale, and helps widen blood vessels from the inside. Research from the American Physiological Society confirms that nasal breathing lowers blood pressure compared to mouth breathing. So every technique you will learn today involves inhaling through your nose, and that is not arbitrary. You are not just drawing in air. You are drawing in a natural blood pressure aid that your own body manufactures. You have more control over this process than you might realize, and these 3 techniques show you exactly how to use it so you can take an active role in your cardiovascular health rather than feeling entirely dependent on a prescription. Now let me tell you about a retired electrician, 68 years old, who came in after his second blood pressure scare in a single year. He was already on medication, but his evening readings kept running high. This is incredibly common after 60. Cortisol tends to spike later in the day, the body struggles to wind down, and pressure stays elevated right when it should be dropping. His wife had started checking his numbers twice a day, which came from a place of genuine care, but the monitoring itself made him anxious, and the anxiety pushed the numbers even higher. You can see the cycle. He learned something called the 4-7-8 method. He was politely skeptical the way anyone would be when they hear that breathing might change a number they have been fighting with pills. 3 weeks later, his evening readings had dropped an average of 9 points systolic. He was sleeping more soundly, and his wife had quietly retired the evening blood pressure check because the numbers no longer worried her. Here is exactly how it works. Sit comfortably with your back supported and both feet flat on the floor. Close your mouth and inhale gently through your nose for 4 counts. Not a deep gasp, just a smooth and steady breath in. 1, 2, 3, 4. Now hold that breath for 7 counts. This brief pause creates a natural transition that amplifies the calming effect of the long exhale that follows. 7 counts. Then exhale completely through your mouth, lips slightly parted for 8 counts. Slow controlled, like you are gently fogging a window on a cold morning. 8 counts. That is 1 cycle. Complete 4 cycles in a row. The entire practice takes roughly 90 seconds. You can do it in your armchair before your feet touch the floor in the morning or sitting in the car before you walk into a medical appointment, which is precisely when pressure tends to spike the most. Twice a day, morning and evening, is the minimum. 4 times a day is ideal. Published research confirms that controlled slow breathing produces consistent reductions in systolic blood pressure, and both Harvard Health and the Cleveland Clinic recommend this approach. Most people notice measurable changes within 2 weeks of steady practice. One important note: if you feel lightheaded during the hold, simply shorten it to 4-5-7 instead. Your body adapts. The goal is calm and control, not discomfort. 90 seconds anywhere, anytime, and you have given your nervous system a genuine reset. Quick question for you. Do you ever intentionally slow your breathing during a normal day? Type 1, if yes 2, if sometimes 3, if rarely or never. Let me know below your answer. Helps me understand our community better. The 4-7-8 is your daily reset tool. But if you want to shift your baseline blood pressure over time to genuinely recalibrate your entire cardiovascular system, the next technique works on a completely different principle. Think of it as retuning an instrument, rather than correcting a single wrong note. Your heart rate naturally rises slightly when you inhale and falls slightly when you exhale. That gentle fluctuation, the rhythmic rise and fall in sync with your breath, is called heart rate variability. High variability signals a healthy, responsive cardiovascular system, one that adapts fluidly to whatever the moment demands. Low variability, a heart that beats with mechanical precision, and no flex is consistently linked to higher blood pressure, greater cardiac risk, and faster biological aging. Researchers discovered that when you breathe at approximately 6 cycles per minute, 5 seconds in and 5 seconds out, your heart rate variability reaches its peak. Your heart and lungs fall into a kind of perfect synchrony. In that state, blood pressure drops, stress hormones decrease, and your nervous system shifts firmly into the parasympathetic brake. There is also a second mechanism at work here that makes this technique especially valuable after 60. Slow breathing at this pace improves something called baroreflex sensitivity. Think of the baroreflex as a thermostat for your blood pressure. When pressure climbs, the baroreflex detects it and signals your body to bring it back down. As you age, that thermostat becomes less responsive. It reacts more slowly and adjusts less precisely, which is one reason blood pressure becomes harder to manage over the years. Research published in the journal Hypertension confirmed that slow breathing at 6 breaths per minute enhances baroreflex sensitivity and reduces sympathetic nervous system activity. In practical terms, you are not just lowering your pressure during the exercise. You are retraining your body's built-in regulation system to work better around the clock. Here is how to practice. Sit or lie down somewhere comfortable. Inhale through your nose for 5 seconds, smooth and even no strain. Then exhale through your nose or mouth for 5 seconds, same pace, same gentleness. No holding, no pausing, just a continuous gentle wave. In for 5, out for 5. 6 breaths per minute. Practice for 5 to 10 minutes twice a day. You can do this while sitting in your garden or during the commercial breaks of whatever you are watching in the evening. The setting does not matter. The consistency does. Most people notice a meaningful reduction in their resting blood pressure within a few weeks of daily practice. The change is not dramatic overnight, but compounded over months, and you are looking at a genuine measurable shift in your baseline. 6 breaths per minute will feel unusually slow at first. Most people breathe 12 to 18 times per minute without thinking about it. That initial awkwardness is perfectly normal and fades within a few sessions. When was the last time you actually took 5 full seconds just to exhale? In a regular day, filled with errands, news, and family, most people never do, and their cardiovascular system never receives the signal to stand down. This technique changes that entirely. If you are still watching and finding this information valuable, type the word "breathe" below. That lets me know this content matters to you, and every comment motivates us to keep sharing evidence-based health knowledge. Now, this next technique looks the strangest of the three. I will be upfront about that. When it was first suggested to a 72-year-old retired military officer, he stared back and said, "You want me to do what with my nose?" This practice has roots in ancient yogic tradition, going back thousands of years, and I understand that can make it sound like something from a wellness magazine rather than a clinical conversation. But stay with me because the physiological mechanism behind it is solid, well-researched, and genuinely impressive. Your left and right nostrils connect to different branches of your autonomic nervous system. Breathing through the left nostril tends to activate the parasympathetic side, the brake. Breathing through the right nostril activates the sympathetic side, the accelerator. Alternate nostril breathing rapidly balances both branches, bringing your autonomic nervous system into equilibrium. When that equilibrium is achieved, blood vessels relax and pressure drops. Studies have demonstrated noticeable blood pressure reductions within just minutes of this practice, and multiple research trials confirm significant sustained improvements with regular use over several weeks. This makes it particularly powerful during pressure spikes, those moments when unexpected bad news arrives, when anxiety suddenly climbs, or when the day turns harder than you planned. Here is the technique step by step. Sit upright and rest your left hand on your left knee. Bring your right hand up to your face. Place your right thumb gently over your right nostril, closing it off. Inhale slowly through your left nostril for 4 counts. Now place your right ring finger over your left nostril, closing it. Release your thumb from the right nostril. Exhale slowly through the right nostril for 4 counts. Keeping your hand in position, inhale through that same right nostril for 4 counts. Then close the right nostril again With your thumb, open the left and exhale through the left for 4 counts. That completes 1 full cycle. Aim for 6 to 8 cycles. The whole practice takes roughly 3 to 4 minutes. It will feel slightly awkward the first couple of times. Your arm tires a little, your rhythm wobbles. That is completely fine. By the 3rd or 4th session, the mechanics become second nature and your body picks it up quickly. And that retired officer who looked at me like I had lost my mind, he now practices every single morning before breakfast. 6 months later, his cardiologist reduced one of his medications. I am not claiming the breathing alone produced that result. What I am saying is that it became part of a larger picture that changed meaningfully. Think of this technique as your emergency reset button. When life throws something unexpected, and it always will, you have 3 to 4 minutes to give your nervous system a chance to rebalance rather than letting pressure climb unchecked. 3 techniques, 3 different purposes. But knowing what to do is not the same as fitting it into your life, and that is exactly where most well-meaning health advice falls apart. It tells you what to do. It does not tell you how to make it part of your day. After 60, your days have a rhythm, and adding something new can feel like one more demand stacked onto a schedule that already has plenty. So here is a framework that actually works. Not a perfect one, a real one. Morning before you get out of bed. 2 minutes of resonance breathing. In for 5, out for 5 right there on your pillow before your feet touch the floor. It costs you 2 minutes of lying in bed, which most of us are doing anyway. Afternoon or early evening, whenever you naturally sit down. 4 cycles of the 4-7-8. 90 seconds total. No special cushion, no silence, required just the presence of mind to do it. And when something stressful hits, because it will, that is when alternate nostril breathing earns its place. 3 to 4 minutes, and you have given your nervous system a genuine chance to recalibrate. 3 techniques, 3 moments, none of them longer than 10 minutes combined. That is the entire practice. Now do not rely on how you feel to judge whether this is working. Feelings are unreliable. Numbers are not. If you do not already own a home blood pressure monitor, consider getting one. Here is the routine. Sit quietly for 5 minutes. Take a reading and write it down. Then do your breathing practice. Sit quietly for 2 more minutes. Take another reading and write that down too. Do this every single day for 2 weeks. Not occasionally. Every day. Most people see an immediate drop of 5 to 10 points systolic after a single session. But the number that truly matters is your resting baseline over time. The reading you take first thing in the morning before coffee, before checking your phone. Track that number across 14 days. That is where the real change reveals itself. One practical tip: always take your reading at the same time each day. Blood pressure fluctuates naturally, running lower in the morning and higher in the late afternoon. Comparing a morning reading to an evening reading tells you nothing useful. Consistency in timing gives you data you can actually trust. And when you see those numbers shift, even by 5 points, pay attention. Because 5 points sustained over months meaningfully reduces your risk of stroke and major cardiac events. Published research confirms that a 5-point reduction in systolic blood pressure lowers the relative risk of major cardiovascular events by approximately 10% and the risk of stroke by around 13%. This is not something small dressed up as something big. This is genuinely significant. The single biggest predictor of whether these techniques work for you is not which one you choose. It is whether you practice consistently for 14 days. After that, it becomes automatic. After a month, people tell me they feel something missing when they skip a session. That is when you know it has taken hold. One essential reminder: these 3 techniques do not replace your medication. They work alongside it, filling the gap that medication alone cannot fill. Always discuss any changes with your doctor, especially if you have existing heart or kidney conditions. As we have explored today, 3 simple breathing techniques can activate the parasympathetic brake your body already has built in helping you take real control of your blood pressure alongside your current care. Now it is your turn. Which technique will you try first tonight? Drop a comment below and let me know. If this information could help someone you care about, please share this video with them. Hit the like button so more people can find this important health content, and subscribe with notifications on so you never miss our evidence-based health updates. I believe your body wants to regulate itself. That is not a motivational phrase, that is biology, and these 3 techniques simply remind it how. We have prepared more videos on heart health and natural blood pressure strategies. Check the description below to watch. As always, please discuss with your doctor before starting anything new. Thank you for watching, and here is to your health.